Carson, I can just kind of intro you guys first if you don't mind.
I can do that.
Okay. Hi, everybody. Thank you guys so much for being here. My name is Marissa, and this is my son, Jack. He's saying hello to everybody. The joys of doing events from home. So we just want to thank you guys for being here. Yeah. And a huge thank you to Carson and his team at Athletico. We are so thankful that they want to share some of their nuggets of knowledge for all of us runners of all kinds, beginner runners, seasoned runners. I hope everybody gets a little bit they can put in their toolbox to help prevent injuries and gain strength. And feel free to throw some questions in the chat if you'd like. I can monitor those, and I know Carson's got a great team over there too. So without further ado, take it away. Thank you guys.
All right. Well, thank you very much. Again, I appreciate Marissa and NRC letting us do a talk in this format. Nick and I have done several talks down in the basement, but obviously in our world, that's not really feasible. So we came up with the idea of doing an online chat. And if you've seen our stuff previously, kind of updated a little bit, tweaked it a little bit, so it's a little bit different. It's less about the mechanics of how you do things, and we're incorporating more of what we do when we look at runners. So first of all, my name, and we're trying to socially distance, so just you know who I am. I'm Carson Lux. I've been a PT with Athletico for a very, very long time. 30 years plus of experience in a whole variety of realms in the sports medicine and orthopedic background. And I'm here with my colleagues, Nick and Katie and Mike, and I'll let them introduce themselves, and then we'll get rolling.
Right. I'm Nick Teston. As Carson mentioned before, I've helped out with some of the lectures in the basement. We always look forward to doing this event a few times a year with our partners at Nipro Running Company. In terms of running, my background is primarily doing kind of like half marathons at this point. I've done one marathon in the past. Enjoy the obstacle course races, but I've kind of stepped away from that temporarily. So that's kind of my background with running, and we work a lot with the North Central College runners as well. So clinically, we tend to treat anywhere from like the high level collegiate runners to the, run a mile or two a week. We kind of see it all here.
Hi everybody, my name is Katie Helen. I am newer to this location. I've been here, it will be, gosh, I think 2 years in August now, but I've been with Athletico for several years. So I worked up in the Evanston location with Northwestern University and all of their athletes for quite some time, several years. And then coming out here, as Nick mentioned, with the North Central College athletes, things like that. I used to be more of a runner. I've done marathons, several half marathons, things like that, of that nature. I've gotten more into cycling and some of the like triathlon type stuff. I'm hoping to get more into that after my baby girl comes, but hopefully that will be soon. So thank you again for listening to us.
I'm Mike Hedke. I'm a physical therapist assistant. I've been working in the far west suburbs of Athletico since 2008. Kind of a various realm of specialties as well. Right now, currently, I'm trying to work a little bit more through nutrition coaching. So that's kind of the newest thing that I'm doing. But, I have learned a lot from these guys, and we treat a lot of the runners in the area, and looking forward to being the guinea pig for this presentation. So let's do it.
Our model. All of you that want to write how sexy he is in the chat box, go right ahead.
Please do. It helps me out.
I don't see any.
No. So, that's fair. So the topic this evening is a progression of what Nick and I have done before, and it's how to create the anti-fragile runner. As Nick said, we've treated runners from all over the western suburbs that range in, middle school, high school experience up to the high collegiate level. We've even seen a few Olympic athletes or, people that have been trying out for the Olympic trials and things like that. So across that whole spectrum, it's important that runners are anti-fragile. And What that means is they're not breaking down, they're not dealing with injuries, they're not starting to train and then having to shut down because they can't get any traction and stay healthy. So why is this important as a general topic? I did a very quick search a few days ago just to see what would be the best way to summarize the issue with runners, and a study performed by Yale Medicine a few years back showed that over 50%, 50% of runners every year are dealing with an injury. These injuries are typically injuries of overuse or in some instances trauma. But the best predictor of injury in the future is past injury. So because of this, this is a really big topic for any and all runners. So that said, when we see people in our clinic, athletes of all shapes and sizes, we are looking to do just movement screens, assessing how people move in general. And we screen all of our athletes. We truly screen all of our patients at any age, and they're all based around variations of what we're going to look at now. And we're looking for poor positions, limitations in mobility through across the joints of the body, as well as poor movement patterns. So the screen itself, when we're screening athletes or any individual, we look at them standing, and we're looking at from the bottom up, the ground up. The ground and your foot is your interface with your environment as a runner, and for most people that are at least older than Jack's age. So that said, we're looking at the position of your arch. Do you have a high arch? Do you have a flat foot? Are there asymmetries in how you bear weight? Are there asymmetries in the position of your foot? Is one leg turned out relative to the other? We also look at the position and mobility of your first toe. If you have limited mobility in your first toe, that can radically affect the way you run.
So the next thing that we usually will take a look at is we'll look at how you're walking. So similar to what Carson just mentioned, we look from the bottom up. So we're looking at your feet. Are you walking and your feet are out? Are they toed in? Do you have one or the other? We're watching where your toes are. We're looking at different kinds of positioning of your big toe. So then we move up. We're looking at your knees. Are your knees dipping in? Are they out? Are you getting any kind of rotation from the hips, working your way up? We look at your trunk. We look at your arm swing. Do you have a normal arm swing? Do you have no arm swing? All those things make a big difference, especially, not only just your day-to-day life, but especially for our runners. And so those are all the different things that we tend to look at with the walking. So then the next thing we're looking at is, standing on one leg, looking at your balance. What does that look like? So if you're standing on one leg, but say, you're kind of rotating here, or you're dropping a hip, or your foot's turning in or turning out, all of those different things show us how the different joints in your body are responding. And so by looking at that, thinking when you're running, essentially when you're running, you're jumping up and down on one foot over and over and over again. So if you're constantly here going up and down, you can kind of see where that might create an issue for you down the road. So those are all things that we're really kind of looking at with those things.
And then kind of building off those concepts that Katie and Carson just talked about, we then start putting the patient in a little more functional position, which can tell us a lot of information about how their body moves in general. And then once we identify limitations, we can start working on it and strengthen what's weak or work on the mobility restrictions that are causing the poor mechanics. So we take a look at our two variations of squats. You got kind of like your basic two-leg squat, okay, where you squat down, come back up, and then after that, we take a look at the single leg squat, okay? And in terms of squatting with runners, this becomes very important because your squat can tell us a lot of information in terms of, are you using your glute muscles and your posterior chain the right way with the way you move? Or if we take a look at the ankles, are your ankles so tight such that...
Sure, why don't you face toward me?
Are your ankles so tight such that you can't clear appropriate mechanics? Okay, so that's a pretty good single leg squat. There we go. And that's better. And then,
You want me to do a bad one?
Yeah,
so
do a bad one.
and then we'll do a bad one, where his trunk is falling over to the side, his knee is
Do it
collapsing
facing
in.
straight ahead too.
Bad one?
Yeah, do a good one, and do a bad one.
On the spot. So, decently good.
Pretty good.
Yeah.
Give it a thumbs up, sort of.
Terrible.
That's horrible.
Yeah.
Don't do that. Don't be that guy.
Yeah, and so basically what that tells us is how does the ankle move in terms of mobility? Do you have enough mobility for you to run appropriately? Do you have enough ankle stability to stabilize at the foot and ankle joint? Or do we need to work on strengthening there? If we go up the chain, if the knee collapses in like we saw with Mike's, all right, that can tell us a lot of information about hip function and ankle function, okay? And then the other thing is trunk position. So a lot of times we'll notice some core deficiencies in how runners can stabilize across their pelvis, up their trunk and down through the legs, okay, to get that nice stability.
Oftentimes, as Nick was speaking about the knee, oftentimes the knee and runners with knee pain, anyone with knee pain, the knee is often the victim of problems going on at either the foot and ankle or at the hip. So if you're a runner right now dealing with knee pain, that's where your symptoms are occurring, but that may not be the root of the problem. Could be above that or below that.
Yeah, that's a great point. And if people are kind of curious, and Katie touched on this before, why would runners need to do single leg squats or be strong in single leg stance? You're running is essentially you're kind of bounding onto a single leg every time you go. If you think about how many repetitions you do throughout running, that's where you need to be very stable. And a large majority of injuries occur during single leg stance during running. So it's kind of like this phase of running is where we're going to see that mechanical breakdown, and that's where we're going to see the tissue breakdown as well. And then moving on from the squat position, the two leg squat and the single leg squat, another overlooked thing is what does the trunk mobility look like? So during gait and during running, there should be a natural amount of trunk rotation and arm swing. I'm kind of over exaggerating now, but that is what we should see. Sometimes we'll see runners run very stiff, where they get no swing in the arms and the trunk's not moving.
Or swing on one side, but not on the other.
Exactly, or you see asymmetric patterns. And that can tell us different things about how is the energy being transferred from the hips up the spine. And then that can decrease your running mechanics and efficiency as well, which can lead to decreased performance, but also put you at risk potentially for breakdown in the future.
So that's a brief rundown of what we screen for. And again, as we see these things in the clinic, we kind of follow what you show. If you've got an issue in one area, we go down that path and see where that leads us. We may find something else altogether. So that's what's fun about treating athletes and runners is you guys are highly motivated and you're most often willing to do the work, and you can be really, really interesting puzzles to try to solve. So once we've done the screen, what do we do with that? So then we get into corrective exercises and corrective techniques. Now, one of the very, very first things we work on is what we call mobility work. And that's a lot of, rolling with foam rollers, which we have some examples of. There we go. So we've got a smooth roller. We've got the smooth roller here. We've got a trigger point roller. We've got a rumble roller. So it's basically your bachelor's degree, your master's degree, and your PhD in self-torture. And for those of you that need these, if you don't know this, you go around the counter when you walk into the main NRC, right around to the left, and then all of the stuff is there. And they'll be happy to sell it to you. But this stuff is vital. And the reason it's vital is I tell all my athletes, and I don't care if you're a runner, CrossFitter, gardener, everybody has their sexy thing they want to do. This stuff is not sexy at all. But if you want to perform and be able to do the thing that you want to do at a high level, being able to working on the mobility stuff consistently enables you to do the things that you want to do. So when we do the rolling, and our lovely assistant Mike here will demonstrate some rolling. Just start with some glutes. So,
Carson, can I interrupt for a second? We had a question, what we guys were just talking about. Would adding in pistol squats into a strength routine be beneficial to runners who already squat, do lunges, Bulgarian split squats?
I would say yes, but that's a qualified yes.
Say potentially.
Potentially, because I would need to see what the mechanics look like with these other squats to make sure that a pistol squat is appropriate. So good question. Could it fit into a program? Definitely, but it depends on how you scale the program. A pistol squat is a very advanced exercise. Mike trains a lot. So for him to come in and be pretty cold and demonstrate a good pistol squat, that's due to his training and his foundation. So he's good. If it's something that you're new to, yeah, there's no equipment involved in a pistol squat. However, if you're not trained in it, you're not experienced with it, you know, it's not a good way to train if you haven't mastered that movement pattern. To advance to a higher level of movement, what I tell people is they need to own that movement pattern. And so if it's something that you're looking to add, you need to build up to it, whether it's a small pistol squat to like a chair or a stool, something a little higher so you can tap with your butt and then come back up, great. If you're trying to do one all the way down or a very deep one like Mike really can do and do well, if you do that too quickly, you don't really own that movement pattern, and so you're going to develop compensations, and then you're not really training it the way you're supposed to. So I'm sorry, so go ahead. So
Actually, Mike, move back a little bit,
Yeah.
make sure they can actually see.
yeah, so we want to make sure. So we do the mobility work, the rolling work, pretty much for runners, everything from the waist down. And as Nick was talking about before, when we see issues in the spine, we do a lot of spine work as well. So right now, Mike's demonstrating just performance roll. Why don't you show everybody's favorite? Show the IT band. IT band lateral quad. Everybody loves this. This is hugely important. You know, if you're tight through these structures, again, that's a main connecting structure, a main fascial structure from your hip to your knee. And the fascia that runs from the hip to the knee even comes up and becomes continuous with the thoracodorsal fascia in your low back. So if you're tight through here, it can potentially affect 3 areas. So it's important to be mobile through there. We do a lot of mobility work with, why don't you grab the beastie ball? We'll use lacrosse balls or beastie balls, which is the little brother of this guy right here. And that's really good for rolling out the plantar arch. And even in other areas like up in the hip, in smaller areas where the rollers are a little too big and they don't really fit in well, the rollers can fit in really nicely.
Feels great.
Into the hip. And Mike's having a great time right now. He's crying a little bit. So, you know, the mobility work is really, really important. So that's what we do with tissue. Now, a lot of the mobility work, other components of that just involve creating proper movement. Now, one of the things we'll get into is Mike would be so kind as to demonstrate. Yeah,
Okay.
yeah, we're done on the ground.
Okay.
Show hip cars. You can hang on to the table. So
Okay.
what Mike's doing, there's an acronym for a type of stretch you can do for any joint in the body. It's called CARS, which means controlled articular rotations. And we do it a lot with hips. You can do it with knees. You can do it with the lumbar spine. You can do it really with any joint. But as a good example, today we had a high-level athlete in from one of our local colleges. And to try to do this particular movement today, he was almost in tears. He was pretty miserable. He was so tight. What you're looking to do is create a lot of motion through the hip, open the hips up, and usually you hang on to something so you don't fall down. But you're trying to really rotate and open up. And he could not do this without twisting and making sad faces and screaming a little bit, you know. So you need to have good hip mobility. You can't load a joint, and every time you land when you're running, every time you come down, that's approximately 4 to 7 times your body weight every stride. And if you don't have the mobility, it doesn't matter how strong you are, your joints and your whole kinetic chain are not going to adequately dissipate and redistribute that force to not be painful. So again, if you want, why don't you face him to the front so they can see that right. So do that right side.
To this side.
Yep. So he's opening up his hip. So what this shows, Mike is able to just with one pretty simple movement work through all planes of motion that the hip has to work in. Yep, go around one more time and then come back and go backwards. Reverse it. So see, Mike's working real hard to not move here and isolate that movement into his hip. And doing things like that, again, the more mobility you can create, the more you open up the capsule of the hip, the support structures, the fascial structures in and around the hip, the more adaptable the joints and the tissues will be to when you're doing your running, when you're doing any type of training. So you want to jump in on some of the thoracic stuff?
Yeah. So as I spoke about a little bit earlier, is we also look up the chain to lumbar spine. So that's the low back, and then thoracic spine, which is kind of your mid back here on Mike, mid back, lumbar spine, thoracic spine. Yep. And this is a very important segment in terms of how the energy transfers up and down the chain. Okay. So I'm going to have Mike demonstrate a few things that we take a look at in terms of mobility exercises that we like to do for the thoracic spine. The first one involves this nice roller here. So we're going to take a look at how the spine moves through this plane, but also how it rotates. And Mike's going to demonstrate a few exercises here for us. You can just do the femoral extensions, please. Over here. Yeah, we'll do it. So you get like side view here. Okay, so a nice simple exercise here is you just lean back over the femoral to open up the thoracic spine and help you get to a more upright position, okay? And what you do is you're gonna get the hands behind your head, if you guys can see Mike down there, to help open up your thoracic spine a little bit more, okay? So that's a very effective one to loosen up the spine and the front and back plane. And Mike, if you could demonstrate the reaches. Yep. Okay, and now the next one will be to help with the rotation of the spine. And Mike's going to demonstrate a reach through here where he's trying to take his chest and open it up to the wall to get a nice stretch through the spine. And he would do that on both sides. We do like 10 repetitions on each side so that each side is moving correctly, okay? And the idea is that the better the spine moves in this position, that'll translate to better running mechanics as well. And then Carson, do you want to touch base on some of the like multi-planar thoracic spine exercises you have people do?
Like the lumbar cars, you mean?
Lumbar cars, or like we can even incorporate it like into some of the
the hip matrix. Yeah.
Yeah.
So let's grab
Chair.
grab a chair real fast. So some more anchored movements to loosen up the hips as well as the spine. Thank you. You want to demonstrate the matrix? Okay, I'll walk you through it. So another means of stretching the hip. Now here's a good way to stretch the hip. Go ahead and move into it, just in and easy, in and out. So he's actually mobilizing the anterior structures in his hip here on the leg that's on the ground. It's really not working the leg that's elevated in the chair. The idea is he's working, and right now he's moving in what we call the sagittal plane. He's moving straight ahead to open up that hip. Look at the extension he's getting. Extension is a movement that has to take place to have a good running stride. You need to have that mobility in the hip. Now, go ahead and do it. Let's turn you so they can face this way. Okay. So now Mike's going to shift forward again. Sorry, sir. He's going to shift forward again, but now he's going to side bend. So now he's opening up the hip. He's opening up the outside portion of the hip. He's trying to loosen up the tissues in that area. Come back up, and then he can go the opposite way. And that actually gets a little bit more in toward the groin and the adductors. So again, he's working all around the hip, and he's kind of whimpering. Another way is he's shifting forward again, and now he's doing a pure rotation. So he's moving what we call the transverse plane. And again, he's trying to hit the hip. The hip is a 360-degree joint. So he's trying to work around that joint in as many planes of motion as possible to try to open up those tissues. Now, he can even combine those motions. So he can go ahead and shift forward and start to side bend and then rotate. So he can do a whole lot of different stuff here. And open up his hips. And he's very quietly cursing me under his breath. But that's a good way to loosen some of that stuff up. We have, I'm not sure the lumbar cars now. So he's really happy about this. So, you know, we talk about loosening up, as Nick was saying, you can be restricted in the thoracic spine and the lumbar spine. So we work on the cars that controlled articular rotation to work on mobilizing the joint of his lumbar spine. So right now, Mike is locked in place, not moving through the hips at all, almost as if he's surrounded by a circle of rollers that don't let him move through his hips. And he's only moving through his lumbar spine. And the idea is, again, he's creating mobility. He's stretching tissues. He's actually curving his spine. Let's go ahead and face that way and demonstrate. So see, we always talk about for lifting and moving, you want to maintain a neutral spine. Well, the spine's built to flex. You just need to be able to do it in a manner that you can control and doesn't cause pain. So go ahead and do that again. So he's going to come forward, and you can see when he gets to the front. See, he's curved his spine. That's okay. Does that hurt? And it doesn't hurt. So you have the mobility. You have to have access. You have to be able to gain access and maintain access to that mobility. And so this is a good stretch for that. So the last thing I would talk about on mobility is the concept of dynamic mobility. So there's static mobility, static stretching, and then there's dynamics. And if any of you, many of you have done any of the running groups through NRC, any running on your own, I know if you do it through NRC, there's a dynamic component to that warm-up, whether it's, you want to just demonstrate standing in place, like a high knee skip.
High knee skip.
So there's warm-up pieces prior to your run. All of us here have treated runners that say, tell me about your warm-up. I run slow and then I run fast. That is not an adequate warm-up. So you need to do dynamic stuff. So Mike was doing the high knee skip. We do what we call the toy soldier. So he's working on creating a dynamic stretch in that hamstring. We do walking lunges. You can do walking lunges with reaches, rotations. So you're combining some of the other elements that we spoke about with spinal mobility. Everybody's favorite. Mike will love to demonstrate this, the inchworm.
Which way do you want me to go?
Yeah, go that way. So inchworm is great to mobilize and stretch this whole posterior chain. So his back, his glutes, his hamstrings, his calves. You know, this is important stuff. Don't need to do a lot of it. You could do 20 feet of this each direction, and that's a good way to prep and get you ready to run. We save the rolling. In the rehab environment, we do a lot of rolling early in the treatment. But once you're released out into the real world, what we have people do is we do the dynamics, then you do your workout, whether it's a hard training run, an actual race, a CrossFit WOD, whatever you're doing, and then you save the rolling for afterwards. The premise is you want to mobilize and have that tissue ready to go. And I don't mean ready just like stretching and pulling, but you've also kind of turned on your nervous system. You've increased your neural activity. So from a neuromuscular perspective, your body's ready to perform. Then you go do whatever you're going to do, and then when you're done, the idea of doing all the rollers and everything is to work out the lumps, the knots, the sore spots that are going to happen over the course of your training or your workout. So another piece now moving forward, and I'll let you guys jump in for a sec, is we do a ton of strengthening and stability work. You want to hit that? Hit some core stuff?
You want me to do the core stuff?
Yeah.
I'll do it.
Okay.
You guys lead, I'll do.
Okay, so he's our lovely model.
Yeah.
So with a lot of the core stuff we do, we really focus on what the core is designed to do. In terms of function, the core is really not designed to do sit-ups and pelvic tilts and things like that we do in the rehab setting. But in a more advanced clients, more advanced patients, we do a lot about core stability, and a lot of that is stabilizing here to be able to move the arms and legs. Prime example of that is your plank. So Mike will demonstrate a plank. One of the classic things we see in the plank, or that we don't see that we should see, Mike is doing an excellent plank. You can't see this. I can feel it, and it's great. He's actually squeezing his glutes really, really tight. A lot of people will do a plank. Go ahead and take a break. A lot of people will do a plank and they never activate their glutes. Your glutes, your adductors, your quads, your hamstrings, your low back muscles, even through your shoulder girdle, that's considered part of your core. So if Mike, go ahead and do a plank again. Don't contract your glutes. Okay? So here, there's nothing going on. Okay? But what that means is he's overutilizing his abs and he's not getting enough support from the whole structure. So now go ahead and dial your glutes back in. See how he tucks a little bit more and he's a lot more stable. Relax. See, I can drop it and he doesn't really bounce back up. Go ahead and squeeze again. See, he's not going anywhere. So that is a good plank. And then from there, there's variations on the plank where he could be in that position. He could lift one foot. He could lift one arm. He could lift, opposite arm, opposite leg. Just, again, other ways, they call it a Superman or a bird dog, other ways to engage the core a little more dynamically. So do you want to touch on eccentrics?
You said you'd like to talk a little bit about it.
Yeah, I can talk a little bit about it. So we like to do a lot of eccentric strengthening here. So when we say eccentrics, there are different ways that you can load a muscle. And when we say loading a muscle, that could be anything to do with the calf, with the quad, with your glutes, any type of muscle. And there are different ways to load that muscle. We use eccentrics. So essentially what that means is we use lengthening that muscle in order to help strengthen. It usually feels a little bit better, and it kind of happens a little bit faster too when you're loading eccentrically. So it cuts down on some of that pain as well, especially depending on what type of injury. Is it a tendinopathy, tendinitis, one of those acute injuries? You want to make sure you're loading that tissue, and that's one way that we do it. The big part that we like to focus on is that posterior chain or your glutes. So kind of going back to what Carson was talking about when you were planking, you have to have that glute activation. And unfortunately, we see that pretty common in the running community is you guys have fire quads. I mean, they're fantastic. Unfortunately, your glutes aren't at the same par. So we focus a lot on the glutes here. Do you want to do, do you want to do like an eccentric maybe squat? Yeah. Like a mini pistol squat, since we had a question on it earlier. Yeah. Let's do it on the chair. Yeah. So Mike's going to demonstrate kind of a modified pistol squat since we had that question earlier. So this is going to be kind of a modification to that to work on those glutes. So Mike's going to kind of load himself down with one leg, but then he's going to come up with two. That's eccentrically loading that muscle. Okay.
And when she says that, eccentrics are a lengthening contraction. There's really three types of muscle contractions. There's your isometric where you hold, or where's the beach kind of thing. Then there's your concentric, which is like doing the up portion of a curl, and then your eccentric is your lowering. You don't take a curl, you don't take a barbell or a dumbbell and just drop it. You'll hurt yourself. So you lower yourself under control. Go ahead and do that again. So what Mike's demonstrating is this eccentric of his whole posterior chain. And then he comes back up. And he didn't grunt too much. Yep, just like that. And then again, go ahead and progress.
That was pretty much all I wanted to cover. I just wanted to kind of touch base on, different ways that we load the muscle to kind of strategize and get you guys back a little bit sooner. And we can, again, do that with multiple different muscles. Another way would say, do it with the calves. You know, you're raising up on 2 legs, but then you're coming down on 1 leg. That would be another eccentric load. Calf strengthening would be another one that you want to focus on.
And another one in between that's really, really important is your hamstring.
Again, posterior chain, hamstring.
Posterior chain. So this, in this setup, go ahead, Mike's going to pull this band down at a normal speed. Say it takes him a second to bring it down. He's going to let that up at about a 3-4 second count. He's controlling it. He's really working his hamstrings. And this, you're creating a load eccentrically, which is what happens every time you land. When you are running, every time you land, this motion here, there's a little bit of lengthening in your hamstring. And so this helps train that. So we do a lot of work with bands here. Bands are really, really beneficial. Nice. Pop you out of that. Well done. Oh, you're gonna be the you want to put it on that side. Sure. Might work better there. That should hold. All right. What's it?
Yeah.
So next we move down to the ankle strengthening piece of it, and we're looking more in the frontal plane. So what does the ankle do as we're running like this? And those muscles primarily are located on the inside of the shin and outside of the shin. So a great way to strengthen these functionally for runners are to attach a band to the lower part of the ankle, which we've done for Mike. And what we're seeing here is when the band resistance is on the outside portion of the leg, we're strengthening the muscles on the outer portion, the perineal muscles, okay? And what we'll have the athlete do is raise up on their toes to give another kind of unstable platform to have to control through. And then we're working on taking steps out to the side against the resistance, and then 2 steps back in, so he has to control that. Okay, we want to make sure the feet are lined up, pointing straight ahead, and he's not trying to compensate through his hips. If you can show us like a bad one, Mike, where your foot's opening up as you step out, that's a common compensation. Or they're unable to stay up on their toes, okay? So, and then that's a very good way to strengthen the muscles on the outside part of the ankle. And then if we switch to the muscles on the inner part of the ankle, we want the band wrapped around the inside part. Now we're working more that posterior tibialis. This muscle is the one that's most responsible for stabilizing your foot and your ankle when you run. So it's very important to have good strength here. But the exercise concept is the same. Raise up on your toes, take 2 steps out, make sure the foot is pointing straight ahead, good stability from the athlete. And that looks really good, Mike. And the compensations will be kind of the same as before, where the foot opens up, the band yanks him back over there. All right, so Mike did a very nice job demonstrating that. Very effective for balance and strength across the ankle joint. And then if we transition that kind of into like additional ankle strengthening in single leg stance, which again is that functional position for runners. Yeah, what we can do here is I'll have Mike demonstrate. So he's going to be in single leg stance. Actually face towards me, I think, for this one. We're getting him in a little bit of a knee squat to kind of simulate what it looks like during running. And what he's going to do is work on rows. So he can row in towards him. So it forces him to work on single leg stability while rowing. Again, works that posterior chain. Okay. And then another one we can do is if we swing the resistance over this way, and we have Mike work on punching straight out. I'm getting a little too much resistance. Sorry, Mike. And again, working the muscles of the trunk and the ankle in a very functional position for that of runners.
And what he's doing is he's moving in a way, as he moves his arms out, he's preventing rotation. The way Nick was set up, the band, when he pulls out like that, the band wants to rotate him. So Mike's engaging all of his core muscles, especially his flank, his oblique muscles, to prevent that from happening.
Yeah, and then our last one here is advanced strengthening, which I'll kick back over to Carson because he loves playing with kettlebells, and he'll be giving you the best explanation of how you can tie in kettlebells to your workout as a runner.
Okay. Well, I would also
Yes, Carson.
Yes.
Can you show us maybe how to modify that if you don't have someone else to help you with that?
Oh, yeah.
Yeah.
Yes. Here's what we do. We take. Oh my goodness.
He said she good. That's Boy Scout knots.
Oh, Boy Scout knots, dude. Got another band. Okay.
Do you need a loop one?
I was gonna say, we can grab another
Here.
one.
No. Here, I'll do it right here. So what we do is we cut band, or we anchor, or create anchors in the band. So we put a knot right in the middle of the band, okay? That little knot closes nicely right inside the frame edge of a door. Close the door, you slide it inside, close the door on it, it catches, and then you've got an anchor, a stable anchor to work from. That can work really well. As long as nobody's on the other side of that door and decides to open it, you're good. I hope that answered your question. So, as Nick was saying, in terms of more advanced strengthening, and it really is important for runners to have good general strength. If you look at the three of us, excluding our pregnant colleague here, the three of us, we are not petite runner build, but you don't need to look like us to be a good runner. You just need to have good strength. So really for runners, it's not about a lot of weightlifting. We talk a lot about calisthenics, push-ups, like what Mike was doing with the planks, like go ahead to a high plank. So high plank right there, that is the top of a push-up. Now from there, go ahead and lift a foot. Okay, now do a push-up. Okay, what he's doing is he's taking a very basic exercise that usually has 4 points of contact. He's making it more difficult by eliminating a point of contact. Now, he can even do things where you take an outside resistance, where you want to hold that. You hold one in this hand, and so you're going to do a row while staying tall. So he's going to hold himself, and he's pulling in. He's doing a row. So again, he's doing stuff. It's really about this. Yes, he's using his arms. Yes, he's getting some benefit from, the bicep, if you will. But he's really loading his core, and he's creating means of destabilizing outside his body beyond just the 4 points of contact. Reduce a point of contact, destabilize the surface that he's on. You can do that with squats. We do squats on different AirX pads. We'll do squats on what we call a BOSU, which is basically like a half a Swiss ball, which will magically appear here shortly so you can see exactly what we're talking about. And Mike will be happy to demonstrate some squats on that. So there's always ways. I'll do it on both. Let's start that way. So here is your BOSU. It's basically half a Swiss ball, and you can do push-ups on it, but Mike's going to demonstrate squats. So he gets on there, and then he's on an unstable surface, and it takes a lot more core control. And then this takes it even to the next level.
Be careful with your balance with this one.
Yeah.
Please don't fall off of it if you try this at home.
But see, Mike trains really hard. So for him, this is an appropriate level of training. It's not too advanced for him.
And then you guys can change the tempo too. So like 3-2-1 squat for the eccentric. Like you can go really slow and then hold and then jump up. Not jump off because that would be dangerous, but
moving quickly
up.
Yep. So there's all kinds of different ways to do that. And then I would say the last piece that, again, you can do all kinds of actual strength training, and you can use barbells and dumbbells and things like that. But the thing that I am most partial to, that I use with a lot of runners, and I've used with runners, high-level runners, is a kettlebell. And once you understand how to use a kettlebell, what I would do is I would have that athlete work on simply two-hand swings, and you develop a real strong cardio strength base, and you can even move to one-hand swings. Mike has a lot of kettlebell experience. if you don't mind, why don't we have you face that way? And let's not crush him. And have him just do some two-hand swings. Oh, get out of the way. So right now,
This is light.
Mike's popping, and he's too strong. So hang on, technical difficulty. So right now he is both concentrically and eccentrically working his posterior chain with a pretty hefty outside external load. Now, when I do this, when I've got an advanced athlete, particularly a runner, what I'll do, once they've got good technique, then I'll work with them on doing that for time. So with Mike, I may have him do a 15-second interval of just however many swings he can do with good technique, then rest for 45 seconds or a minute, and repeat cycles of that. And I may build him up over the course of several workouts to where he's doing, 30 seconds or 45 seconds with a 45-second rest, or swing to the point where they're swinging like a minute and resting a minute, or resting even less. And that becomes very similar to doing like 400 repeats. So with your higher level athletes, this is something that can work really well. If you wouldn't mind showing from the front, you'll go swing to the front, do a single arm swing. So another one that works really well is just the single arm swing. And so the way Mike's doing this, there's a lot of unilateral load. He's really loading to stabilize his trunk and prevent himself from rotating as that bell comes through. And so again, that's important. That promotes that rotational, that counter rotation that you need as a runner. As Nick was talking about earlier, if you're locked through here, if you don't have good mobility, this is hard to do. So this is obviously more advanced, but that mobility, you need that mobility. You need that counter rotation between your pelvis and your shoulders to help you maintain balance. And having that helps you maintain power later into your training, later into your races. So there's a whole bunch you can do with that. And I know for the majority of people here, this is a nice adjunct. We could go down a rabbit hole with the kettlebell. I won't do that because I don't want to bore you to death. Now, the last thing that we all work with here, we do a lot with running mechanics. The method that we use here, if you're not familiar with it, there's lots of different ways to train running mechanics. But we primarily do what's called pose method running. We've all had experience with it. I've actually been certified in it. And really what you're trying to do is create more efficient stride patterns, because no one really knows how to run correctly. Running correctly is a learned behavior. The best example I could give is if you were to watch, say, Nick and Marissa, they're high-level runners. If I watch them late in a race, say a 10K, their running mechanics are going to look way better than mine, where I would fall apart. Everybody runs a little bit differently, but we try to bring everybody around to what we call pose. Can I borrow you so you can see? So what is pose? Face that way. Go ahead, stand on your left leg and get a little bent. Okay, and so this position here is what we call pose. Everybody gets into this position at some point in their run, whether you're an elite runner, whether you're an amateur, out of shape runner, whether you're a tiny runner, old runner, doesn't matter. At some point, you will hit this portion of your stride where you're moving and you're stable before you go to the next stride. It's the points before that and after that where runners have problems. And we do a lot of work to correct that. And a lot of that can revolve around just cleaning up a runner's, you can relax, cleaning up a runner's cadence. Oftentimes we see runners, and it's been runners, even again, elite level runners from the high schools, some from North Central, that just run at a very slow cadence. And the problem with that is when you run at a slow cadence, running is different from walking, because when you're walking, one foot is always on the ground. When you're running, you're actually at some point in flight where you're not touching the ground at all. Nobody gets hurt in flight. You get hurt on the ground. And the longer you spend on the ground, the more likelihood that there is that you can sustain an injury if you have any of the other issues we've spoken about earlier. So what we try to do is we try to get people running faster and more efficiently with actually a more compact stride. A longer stride lends itself to a slower cadence. A shorter, more compact stride is more efficient and lends itself to a faster cadence. And then I would say, as the last thing I would talk about for all of this, and circling back around, is we sometimes get questions about footwear, and I always defer to Nick and Marissa and everybody at NRC, because I know what I'm trained to do. We all know, we all have our areas, but in terms of knowing, drops, knowing, rear foot stabilization, things like that within shoes, that's not our area of expertise. So I always defer to the expertise that these guys have. So really, that's all I've got. Anything you guys would like to chip in?
No, the only thing I want to add is just thank you for listening to all of us blabber on and be nerds about this stuff.
Yeah, we
love
really nerd.
We love treating runners. We really enjoy working with you guys. So thank you for spending the time with us.
So at this point, do we have any other questions out there?
Nothing in the chat. I do want to let you know I cried a little bit when I tried to do that hip cars.
Yes, good.
In my defense, Coach Nick also couldn't do it very smooth, so we're doing great over here.
Good.
And Carson, you clearly have not seen either one of us finish a 10K very recently because it is ugly.
You gotta ramp your training.
I prefer the longer stuff now. The 10K hurts too much. We do have a question. First one, do I need a prescription to see you?
No. One of the things that we do free injury assessments, which means you can come in, either walk in off the street or call the clinic ahead of time and set up an injury screen where it's a complimentary screen. We get people that come in with, I think I've got something here, I think I've got something here, I think I've got, whatever it is. We see it for all manner of injuries, but we see it with runners as well, where you can come in, we give you an assessment, very similar to what we've talked through this evening, and then we help set up a plan of what you need to work on. Sometimes we see people that they're beyond the point of their issue that they actually do need to start therapy right away. But sometimes it's like, here's some things here's what we see, here's some things you need to work on. We want you to work on those. Give it a week, give it 2 weeks. If you're still having issues, then we probably need to circle back and talk about actually initiating therapy. But yes, we do see people, 8 to 10 screens a week sometimes? Yeah, so we see a lot of screens, so.
Great. And next question, what should we do for shin splints?
Well, again, I would start at the bottom and I would make sure, one, you've got good footwear. You change your footwear out. You're not letting it get too old. If you're, a moderate runner, 300 miles might be enough. If you're a heavier runner than that, you might need to switch it out earlier than that. But then again, as we were speaking of earlier, looking at mobility of the foot, sometimes the foot and the ankle get locked and they don't move well. And, we'll do a lot of stuff to unlock a foot, and people will walk markedly differently. And they'll, say, wow, we see people, their big toe doesn't hit the floor. They're stuck on the outside of their foot. If you're stuck on the outside of your foot, all of this tissue through the outside of your foot gets really, really tight. It never gets a chance to take a break. When you step and you come down and you land, yeah, your knee's going to drop in a little bit, but you need to be able to control that with good strength. But this is a little bit of break for these outside structures. The ability of the foot to flatten the ability of the knee to turn in a little bit, the ability of the hip to turn in a little bit. All of that helps dissipate ground reaction force, meaning instead of all of that force coming back straight up through your body when you land on the outside, it spreads it out, it disperses it out. So you're not really bearing the brunt of all of that 4 to 7-fold body weight with every stride. It sends it out. So if we got all of that force back, none of us would probably run more than 100 yards because we'd break, we'd fall apart. So that's why our joints function the way they do. And if you're not using those joints correctly, that can lead to shin splints. So back to the original question with shin splints, if I didn't forget the original question, with shin splints, if you're stuck in your ankle at all, if your foot or ankle is restricted, that can really contribute to shin splints. So can the history of old ankle sprains, things like that, tight tissue. Again, there's lots of causes, and that would be one that I would say you should come into the clinic and we could take a look at and come up with a game plan.
And just volume too. I mean, if you're hitting the ground running, 5 miles at a clip, stress reactions are probably going to happen sooner for the weekend warrior that wants to start running. You should periodize your training and get used to that mileage, not just run right off the bat.
Awesome. Thank you. And I can actually answer the next one. The question is, where do they go to see you? And I can tell you that Carson and his team of experts are at Athletico North Naperville, the one right off Ogden and Washington, kind of right in that big strip mall with Jewel. Dairy Queen is right behind him.
If you're running and you need the carbo load afterwards, all takes is over here too.
Yeah. Awesome. I don't see any other questions yet. Jack is sending everyone to Naperville Running Company if you can't hear him. Jack, where do Mama and Dada work?
Naperville Running Company.
Yeah, good job. But no, thank you guys so much. And we send all of our customers to Carson and his team. We are treated by him and team ourselves. So we trust you guys. Thank you so much for your time and sharing your knowledge with us. It's super helpful, super, super helpful. I know where to start. My hips are still yelling at me. So, and if anybody has any questions or if anybody needs anything, you can email me at the email that I just sent everybody that link, and then I will make sure Carson gets to that.
Perfect. And again, thank you, Marissa. Thank you, Nick. Thank you, Jack. We've worked with you guys for years. We really enjoy the relationship and getting to treat your runners, and pretty much, I would say almost the entire herd family at this point.
Except for Jack. Jack's good so far.
Knock on wood. But no, you guys, the experience, your expertise is unmatched over there. So, if anything is bugging anybody, you guys are the ones to see. So we appreciate it.
Thank you.
Thank you.
Thank you guys. Have a good night.
Thank you.
All right.
Okay.
Have a good night, everyone.
Good night.
Cool. Wasn't that one?